Facelift procedure is something that patients often request when they're in their 50s, 60s or older in order to improve the contour and the wrinkles around their face and neck. There are many different ways of doing a facelift and different patients need different things, so it's important that the facelift is tailored to the particular needs of the particular patients. I believe it's very important to adequately assess and appropriately plan for what you're going to do before you get in there. It's not a one-size-fits-all procedure by any means. Facelifting surgery is safe, it's done under a general anaesthetic, it's performed as day-only surgery. The procedure involves incisions mainly around the ears and into the scalp behind the ear. If I'm doing a neck lift, I also perform an incision underneath the chin, which is hard to see. The most important part of the surgery is not just pulling skin tight, because that doesn't give you a good result. The important thing is to tighten and rearrange the tissues underneath the skin, to move the tissues of the cheek back up to give nice cheekbone appearance for the patient, to modify the jowl area and to smooth out the lines around the mouth. The neck is a very common area that people want changed in order to improve the contour and to remove the bands, which are called platysmal bands. People often ask, what is the difference between a face and a neck lift? Often they go together in order to address the neck. Commonly, the lower part of the face also needs to be addressed, where the jowl and the bands around the neck are redistributed and the extra skin is removed around the ears and around the hairline back here. Some patients only seek to rejuvenate the cheek area and the folds around the mouth only. They may be candidates for a short scar facelift, where the only scars are within the sideburn and down in front of the ears and just behind the earlobe. The before and after results of a facelift are probably amongst the most satisfying that I see in my patients. Patients not only see a decrease in the amount of wrinkles, they also see an improvement in the curvature of the face, the softness of the face, the prominence of the jowls and any bands around the neck. Face and neck lift surgery, whether it's a short scar or a whole face and neck lift, can be done as day-only surgery. The surgery, in addition to the general anaesthetic, I put a lot of local anaesthetic in, so patients are nice and comfortable and numb when they wake up. I see patients the day after their surgery to make sure everything's okay, a week later to remove some of the sutures, and 2 weeks later to remove any further sutures. A facelift surgery does involve a bit of swelling and bruising. I advise patients to make sure they have no major social things planned for a good 2 to 3 weeks after the surgery. By then, all the bruising should have pretty much gone and they should be back doing everything they want to do.